I'm here with Kelly Fristoe of Financial Partners to talk about the Affordable Care Act. So Kelly, how long have you been helping people with health insurance?
Well, we've been in business over 23 years, since 1991, helping people make smart financial decisions as they purchase health insurance. In today's environment, it's very complicated with the Affordable Care Act. Everyone has to buy insurance or pay a penalty now. And that penalty can be significant. For example, in 2014, that penalty is about 1% of your household income. In 2015, that penalty goes to 2% of your household income, and in 2016 goes to 2.5% of your household income. And health insurance is pretty complicated, and through our industry association involvement these last several years, we've had opportunities to go to Washington, D.C. and talk to legislators about the negative aspects of the Affordable Care Act in hopes that it would produce some positive results in truly helping people make coverage more affordable. And we've seen, because of the climate in Washington, D.C., that that's just not the case. Our industry association also has allowed us to have opportunities to be featured in Wall Street Journal, Bloomberg, the New York Times, Politico, many other print publications, as well as some radio opportunities, radio media opportunities on NPR. Just recently, the Laura Ingraham Show, and I was invited last year to be a guest on Greta Van Sustern's Fox News program. Unfortunately, there was about 12 inches of snow on the ground and we didn't get to make that. But it was fun. So, yeah, but we've been helping people make smarter financial decisions in this incredibly complicated environment. There's a lot of different paths that you can take now to purchase coverage. And whenever you're talking about, is it better for me to go to healthcare.gov to purchase coverage? Is it better for me to go to the directly with the insurance company to purchase coverage? How does all that work? And so we help take some of the complicatedness out of that for the consumer.
So Kelly, how do people know which path to take when they're looking for health insurance?
Well, that's a very good question, and it's not a short answer. There are people that have access to employer-based coverage. And if you do, you're in a situation where you're probably not going to qualify for a premium tax credit or a cost-sharing reduction subsidy. There are some people that have access to employer-based coverage, but it costs a ton of money to put their spouse and their kids on that plan with them. And again, those people they're not suitable for the path of going to healthcare.gov. Those people need to go directly to the insurance company to buy a plan. But a person that doesn't have access to employer-based coverage and make at least 100% of the federal poverty level up to 400% of the federal poverty level for their tax filing status, they would be eligible to go to healthcare.gov and maybe qualify for premium tax credits and cost-sharing reduction subsidies to help reduce their out-of-pocket cost and make the plan a lot more affordable. We can help them access that subsidy, help assist them in that enrollment process. Do not try to go to healthcare.gov on your own. There are a lot of people that will answer questions incorrectly, and it could result in a large tax liability at the end of next year, should they try to do that themselves. If a person makes more than 400% of the federal poverty level and they still have no access to employer-based coverage, we can still help them access coverage directly with the insurance company without going to healthcare.gov and having to go through that whole onerous website system that half the time it's working, half the time it's not.
Kelly, you said there were certain times to enroll for health insurance. Can you tell us when those times are?
Sure. This year, open enrollment began November 15th and goes all the way through February 1st of 2015. That is the only time that you can enroll without having to have a life change or qualifying event. A life change or qualifying event allows you an opportunity to enroll outside of that time frame. Well, people ask, well, what is a life change event? What is a qualifying event? Well, that could be marriage, birth, divorce, adoption of a child. It could be you lost coverage through your employer because you were terminated from employment, or you just decided to quit working and you lost that coverage that your employer was sponsoring. Or maybe you received a letter from your insurance company saying that your plan is going to cancel at the end of this year. Those type of things are life change events. And again, we can help people determine whether or not they've had a life change event or a qualifying event and whether they can enroll outside of open enrollment. But an open enrollment is going on right now, so people need to call me now and be able to get into my schedule so that we can help them do that enrollment. People that need coverage to begin on January the 1st of 2015, they need to enroll before December 15th of 2014. If they enroll after December 15th, their effective date is going to be February 1st of 2015.
Kelly, tell us why we should call you instead of try to get health insurance on our own.
Well, that's a good question. It's really important that you use the services of a professional agent, someone like me, because it's complicated. Like I mentioned earlier about the taxes that are due if you don't purchase coverage. This whole system, there are several paths that you can take to purchase coverage. You can go to healthcare.gov to purchase coverage. You can go straight to the insurance company and purchase coverage. And how does a person know which way to go? There's a lot of parameters around that. You know, last year we saw a lot of people who had called our office during the open enrollment period and even after the open enrollment period, and they explained to us how they tried it on their own and they chose the wrong plan. They chose an HMO plan. And in our geographical area, we don't really have a functional HMO system for people to use. And so they purchased a plan that they're not able to really use, but they're buying something that they can't really use. So it was a tough deal. We also, in our situation, from an agent perspective, one of the things that we're able to do, instead of just enrolling somebody, our services are free to the consumer. We're able to help someone pick a plan that is suitable for the way in which they seek out their health care coverage. Everybody's different. And so when you think about someone needs a low deductible or a high deductible, or someone needs a plan that maybe they go to the healthcare.gov and they want to get a premium tax credit to help make it more affordable. How do you do that? We take the complicated mess out of that situation and make it easy for them. So it's really important, in addition to all of that, we have a relationship with our client that allows us to continue to service that policy, whether it be premium issues or claim issues, which this last year we saw a lot of.
Kelly, it looks like time is running out very quickly. So how can viewers at home get a hold of you if they need your help?
You're right, the clock is ticking. Our office number is 322-6277, and we encourage people, do not wait until February 15th to get in touch with us. Call us now so that we can help you make the best decision that you can in the enrollment process, whether you're enrolling for the first time or whether you're re-enrolling in order to get your correct premium tax credit through healthcare.gov. We can help you do that and get you on the right path to making the best decision possible.